We have 2 more sessions to go before the networking drinks. So please stay with us. The next one is going to be a super interesting one. It's called Healthcare and Education. Around the world, education, leadership, and innovation are driving solutions to major social challenges. From future-ready jobs to smarter, more inclusive public services. This session explores key shifts in healthcare and education. I'm going to introduce our lovely moderator to you, but before that, can I ask everybody to shut down their phone, please, because this is filmed. We want no noise from phones. All right, so moderating this session is partner at CSP Group with deep expertise in facilitating foreign direct investment and unlocking growth across the GCC. Please welcome to the stage, HELEN BARRETT.
Good afternoon, everybody. Thank you so much for joining us. Now, whilst I heard Sarah say, can you sort of shut your phones off, I really don't mind photographs. So if anybody wants to take a photograph, feel free. So today we're talking about some sort of diverse topics. And having started my own career in an era where young women were told that skirts were the most appropriate attire for the office, to becoming an employer myself several generations later, and understanding that employees want to be empowered, and to do that, we need to lead with purpose. The poles apart from the division of the employees and the employers' expectations nowadays have shifted significantly. But what we hope to discuss today is how we are going to focus on bridging that gap through the investment in human capital, entrepreneurial mindsets, and technological transformation, particularly in the healthcare sector. So I think some of you who are in the room today who are business owners, and some of you who are educators, will probably have lots of questions, and we would really like to make this an interactive session because our expert panelists are very, very keen to take questions. But for now, what I'd like to do is introduce them to the stage. So first of all, please can I ask HAIFA ALKAYLANI, OBE, to join us on the stage. I'm sorry. Okay, lovely. Thank you so much, HAIFA. And next, please, may I invite Dr. Peter Thomas, Chief Clinical Information Officer, Moorfields Eye Hospital NHS Foundation, to join us. And last but absolutely not least, may I invite Derek Redmond, world champion, gold medalist, best-selling author, and chairman of Right Brain Thinking, to the stage. Do you want to sit at the end? Yes, please. Yeah, thank you. Now, unfortunately, one of our panelists, KOSAR DARA of Cambridge City Company, couldn't make it today. He is, unfortunately, having difficulties getting out of Kurdistan with the travel situation. Now, what I will do is try to share his perspectives, because I think as our youngest panelist, he had very interesting views on education and technology and what I might think is generational change, but possibly that's not what we need to call it. So first of all, may I invite HAIFA ALKAYLANI to the podium. Now, HAIFA will focus her discussion on education and health for women in the MENA region, and her work spanning 24 years in women's empowerment in the Arab region through global context. So HAIFA, if I could invite you to the podium.
Your Excellencies, distinguished guests, ladies and gentlemen, I'm delighted to join you all today at the Arab Rich Economic Summit 2025, the 4th consecutive year I have had the great pleasure of speaking at this very high-level forum. I wish at the outset to extend my warmest thanks and appreciation to Baroness Simmons, Chairman of the Arab British Chamber of Commerce, and Bandar Ali Rida, the Secretary General, CEO of the Chamber, for their kind invitation. Both as President and founder of the Arab International Women's Forum, and proudly as a board member of the Arab British Chamber of Commerce, I wish to acknowledge the many years of partnership between the ABCC and AIWF to support and endorse the role of women in business and in trade. The Arab International Women's Forum is a leading development organization committed to the inclusion of women and young leaders in business, in education, entrepreneurship, sustainability, and STEM in the Arab region, but always within a global context. Since the founding of the Arab International Women's Forum in 2001 in London, I have held firmly and upheld the belief that women's empowerment is at the heart of development. And the foremost pathway to empowerment for women and youth is through education. Without education, there can be no empowerment. And without the empowerment of women, there can be no social, political, or economic development in our region or anywhere else. This foundational belief has guided my work as a development economist, as an advocate, and as a leader for many years. At AIWF, we see education as both the beginning and the ongoing engine for empowering Arab women and youth, equipping them with the tools to navigate a digital, knowledge-based economy and contribute meaningfully to society. Distinguished guests, for several decades, governments throughout the region have invested heavily in removing barriers to education, empowering young citizens with the skills and qualifications to enter and succeed in a thriving Arab private sector. In several MENA countries, women are excelling at all levels of education, especially in STEM subjects. Female enrollment at Arab universities has well surpassed that of their male counterparts. To share some UNESCO data with you, in Saudi Arabia, women constitute 60% of university students. In Jordan, women surpass men in higher education enrollment. In the UAE, 61% of STEM graduates are women. The same figure, 70% is the percentage in Oman, and 55% of female graduates, STEM graduates, in Bahrain. Across the MENA, 57% of STEM graduates are female, higher than in many OECD countries. The region's 97.2% educational attainment score in the 2024 Global Gender Gap Report is evidence by itself of the tremendous progress made in closing the gender gap in education. Despite their academic excellence, only 20% of women in the MENA are employed, far below the global average of 48%. This gap arises from multiple barriers. First, labor market structures with saturated public sector and a weaker private sector. Second, cultural and social norms discouraging women's full participation in the workforce. Third, legal and institutional obstacles, including mobility restrictions, wage gaps, and limited workforce protection. Additionally, and most importantly, and as mentioned earlier this morning, we have a skills mismatch between the labor market, industry, and academia. Many women graduate with degrees that are not aligned with current job needs. We call in AIWF for bridging this gap by aligning academia and private sector demands, an effort we champion through our partnership with top universities and global businesses, enabling Arab women to move confidently from the classroom to the boardroom. Having served as a commissioner of the ILO Global Commission on the Future of Work, we advocated for a human-centered lifelong learning agenda that includes skilling, upskilling, and reskilling, an approach more relevant than ever now in the age of AI and rapid technological change. Our region must shift from rigid degree-bound models to modular micro-credential education, must promote entrepreneurship education that instills innovation and adaptability, must embed AI and digital skills in curricula while also strengthening soft skills such as communication, empathy, and leadership. Technology is reshaping how we learn and how we work. McKinsey estimates AI will contribute $150 billion to GCC economies. Yet we must not sacrifice the human element. We always believe that and emphasize that platforms matter, but people matter more. Let us not invest in tech at the expense of our humanity. Instead, we must harness the technology to empower our human resource and our human capital. To conclude this section on the education sector, women are the educators, women are the learners, the entrepreneurs of today and tomorrow. With the right support, they will lead us into a more sustainable, inclusive, and prosperous future. To say a few words about the women's role in the healthcare, which is part of this session. Transitioning to healthcare, another critical pillar of development, I wish to highlight how women have long been central to health systems as caregivers, nurses, researchers, and increasingly as innovators. Globally, women make up 90% of frontline health workers, yet hold only 25% of leadership roles. In the MENA region, women are the majority in healthcare roles, 64% in the UAE, 40% in Saudi Arabia, 80% of registered nurses in Lebanon. Women are leading in maternal, pediatric, preventive health, addressing key major challenges our region faces, such as cardiovascular diseases, cancer, diabetes, obesity, and others. Yet globally and regionally, women remain underrepresented in leadership roles. To address these disparities, we have partnered with Pfizer, our Middle East partner, on women's health, and we have launched an initiative called DEI by Design, Diversity, Equity, Inclusion for Women in the Health Sector. The result was a landmark report that has been widely adopted as benchmarking tool across media and industry. Allow me just to share with you some key recommendations that we put in that report following conducting these series of webinars in both the GCC, the UAE, and Saudi Arabia. First, recommendation, promote mentorship, visibility, and leadership development. Second recommendation, embedding DEI into health systems and education. Integrate diversity, equity, and inclusion into healthcare policies, codes of ethics, and medical education. Third, strengthening research and clinical inclusion. And fourth, prioritizing public health equity and community engagement. Recognizing that women's health is a public good, improve health literacy and engage women, especially in refugee and conflict-affected communities, in shaping health services. Through this work, we reaffirm that health is not just a sector, it is a human right, and it must be shaped by those who live, who work, and lead with it. With continued collaboration from Riyadh to London, we can unlock the full potential of Arab women in both education and healthcare leadership to the benefit of the entire communities. Thank you for your kind attention.
Thank you so much, HAIFA. Now, as a female that's been working in the Middle East for nearly 30 years, I'm always asked, what's it like being a woman in the Middle East? I'm pleased to say that it's one of the countries that really has embraced women's empowerment and DEI. And DEI, if executed properly, works. And I think that it is a potentially contentious issue today in today's international world. But I think that we are shown that we have demonstrated that diversity on boards, diversity in teams, and whether that's gender, whether that's experience, whether it's ethnicity, is valuable, and I think the Middle East do this incredibly well. So thank you so much, HAIFA, very much for that. Now, please, if I could invite Dr. Peter Thomas back to the podium. He's a leading voice in clinical innovation and how digital transformation is shaping the future of healthcare delivery. Now, when we've talked about this in our pre-event call, it was very interesting to hear how the healthcare sector is actually providing lots of opportunities for entrepreneurs. And you don't necessarily have to be a qualified doctor to benefit from those. So if I could invite you up to the podium to tell us all about transformation in healthcare.
Thank you. Thank you. Yeah, thank you very much, and thank you for the invitation to be part of this panel and speak to this event. So, the topic of my talk looks quite improbably broad for a 6-minute talk, so I'm going to try and cover innovation, digital health, and upskilling of the workforce. But in fact, those three are really the three pillars that we need to do to transform our healthcare services going forwards. This image on the left there is almost real now. So this is Moorfields Eye Hospital as it will be in 2027. If you happen to be out the back of St. Pancras Station in the Knowledge Quarter, just down the road from the Francis Crick Institute, you will see this building now 10 stories high with the cladding on the outside. And the very philosophy of this building represents those three pillars of innovation, of healthcare and of education. Because it's not just Moorfields Eye Hospitals and its 200-odd consultant eye surgeons and hundreds of hospital optometrists and nurses and orthoptists who will be practicing there. It's also the Institute of Ophthalmology, which is part of UCL. It's the world's #1 research center for the eye, for diseases of the eye, and for the science of vision. And it's also the place where we do absolutely enormous amounts of training. At any given time, we have thousands of people enrolled on our various different master's courses, short courses. And we're also responsible for training a very large proportion of the UK's consultant eye surgeons. But there's many different types of consultant eye surgeons. So I'm a pediatric ophthalmologist, so if you as a child, or if any of your children had eyes that didn't look in the same direction, it would be a surgeon like me who would straighten up those eyes, move the muscles to get them in the right place. But for any given eye disorder, and there are thousands of different eye disorders, there's a very reasonable chance that the world expert in that disorder will be working inside this building here. That's why we provide high-complexity services across a lot of the UK. It's why patients fly in from all over the world to visit our private eye hospital, which will be integrated in this facility. At the top right there, you can see some of the work we do on surgical simulation training. So beginning to use augmented and virtual reality in order to allow us to train the next generation of eye surgeons. About half of all the eye surgeons in the UK we have trained to a significant extent, and every year dozens and dozens of international fellows join us for a year or two to be exposed to really high-quality clinical care and high-quality clinical research, and then take that back to their own countries. At the bottom right, you can see a bit of our international expansion. So we don't just run 20 sites, private and public, across the southeast. We also run 2 sites in the Middle East as well, so Moorfields Dubai and Moorfields Abu Dhabi. So we spent a couple of hundred years building essentially the greatest resource of clinical expertise in the eye anywhere in the world. But for us, the next step is really to tackle a central problem, which is we've got this resource that's unparalleled. We manage, based on our geography, nearly 1 million patients a year across our different sites. But how can we unlock that body of expertise to make it available anywhere in the world? I think this morning we saw in some of the AI and innovation sessions, we heard about telemedicine and artificial intelligence. And really telemedicine is the next frontier for Moorfields and for ophthalmology in general. On this slide here, it's just a few images really. We've been working very hard over the past couple of years to build what's called a digital hospital model. So the idea there being that patients, wherever they are, should be able to access our expertise, whether that's in a high street optometry practice, on the high street in London or on the high street in some other part of the UK or abroad, being seen by an optometrist who's taken a scan of their eye and they've seen something unusual in the patient's eye. We should be able to be there to interpret that image and give advice on the next steps. We should be able to expand our video consult services, which have managed nearly 100,000 emergency presentations of eye problems over the past few years, and done so where the patient can go from opening their web browser to speaking to an ophthalmologist at Moorfields within about 10 minutes. At the top right, you can see one of my colleagues remotely reviewing an image that's been captured on the high street. At the bottom left, you can see the spread of the referrals that this digital hospital model is managing across the north of London. We cover a population of about 2.5 million. And for the first time, we're beginning to really understand our system because we're capturing patients right at the start of the pathway. We know where they are, we know what they need, which means we can start to advise London on how it should develop its eye care services. What are the little black holes, the areas of high patient deprivation that don't seem to have good provision of healthcare services? And at the bottom right, you can see my team winning the Health Services Journal Innovation of the Year Award for the digital hospital model, which is a nice image. But it doesn't just stop at providing expertise remotely based on human clinicians. Because of the scale we operate at, we have what's called a bioresource, so a database that contains 35 million images of the eye. So any type of common or rare disease, we have a vast database of different imaging modalities that we can use to gain new insights into the disease or to train artificial intelligence. On the left, you can see this is an image from our big publication with Google DeepMind that was published, I think, at the end of 2018. And that was really a landmark publication in the field of deep learning, because for the first time, we were showing on images that are captured 12 million times a year on high streets in the United Kingdom, that we were able to apply artificial intelligence to outperform our best professors at diagnosing diseases inside the eye. And we've just spun out our first AI spin-out company from Moorfields and UCL called Cascada, which I have the honor of leading as chief exec and co-founder. And we're going to be bringing those through into products that can be made available globally to bring the Moorfields expertise into settings wherever they might be. We're going beyond that. We're discovering that actually on the right, we can start to work out issues about the rest of your body based on scans captured on the high street. So we published a paper just over a year ago showing that we could start to predict Parkinson's disease, Alzheimer's, maybe 7 years before it became clinically apparent. So this idea of the eye as a window to health in the body shows the real potential for public health provision. And finally, what are the opportunities here? So we find that there's an awful lot of interest among our younger doctors now to pursuing non-traditional medical careers. And they are taking advantage of the many training opportunities that there are in this country to become experts in entrepreneurship and clinical innovation. You see the NHS Clinical Entrepreneur program logo in the middle there. And the UK is fast becoming one of the global hubs for health tech entrepreneurship, the startup scene in health tech here being valued at about £32 billion a year or two ago. So I'll leave it there. So should anybody wish to contact me, that's my email address, but hopefully I've given you a little bit of an overview of how we're trying to digitally transform our healthcare services within the UK, being led by specialist hospitals like Moorfields, so that we can start to provide our clinical care without borders and start to hopefully implement the technology that allows us to scale that globally. Thank you very much.
Thank you. Thank you so much, Derek. Thank you so much, Dr. Peter. It's great to see that AI is going to be rolled out across more than just one area of medical science, but I think Dr. Google may well be looking for a new role sometime soon. Now, I'd like to invite Derek Redmond up to the podium, but before I do, I'd actually like to invite you to watch this short video. Derek, whose journey from Olympic athlete to leadership coach has inspired thousands, he brings unique perspective on mindset, performance, and resilience as key components of personal and professional success.
Thank you. Good afternoon, and thank you for taking a bit of time to listen to me speak. Now, you might think, why has he played that video? Why was that video played? Yes, I do get embarrassed every time I see that video, but I just want to talk a little bit about it and then bring you on to the reason why I'm here. So I was very fortunate to have a career in sport, mainly athletics. Joined my first athletics club at the age of 7 years of age. 20 years later, I find myself having competed for my country 56 times. I've been a British champion, a European champion, a Commonwealth champion, a world champion. Competed in the Olympic Games on two particular occasions. Suffered quite a bad injury in 1992 Olympic Games, which was my last Olympics. And I was told over the next 18 months of trying to make a comeback and 7 operations later that my sporting career was over and I would never compete for my country again and I should go and get a regular job and live a regular life. And as you can imagine, that wasn't something I particularly liked. And 3 years after I was told that by the surgeon, I was playing professional basketball and I had won international for England. And incidentally, I sent that same surgeon a photograph of me playing basketball for England and I put a personal message on it saying, thank you for your confidence. It was a metaphorical middle finger. Let's just leave it at that. I then had a dream and an aspiration of wanting to continue in the world of sport. And at that point, there were 6 of us who had competed for our country in 2 separate sports in the United Kingdom. No one had ever done it in 3. I wanted to be the first person to do it in 3 sports. So halfway through my 2nd season as a professional basketball player, I quit. And I decided to take up another sport that I love, which was rugby. And I got to a point where I became a professional rugby player. And I got into rugby sevens in a huge, huge way. Loved rugby sevens. It really suited my skill set. And I ended up playing out in the Far East for a couple of seasons. I came back to the UK. I tried out for England on 2 occasions, but it didn't quite happen. I'd had quite a long, distinguished career in professional sports. I was getting a bit older. The body had taken a bit of a knock-in. And I decided it's time for me to move on. I had a young family. And I had a couple of business opportunities come my way. So I decided to get out of the professional sport game and focus on being a father, being a husband, and pursue these business opportunities that I had. But I soon got very bored of just working, training, and not competing. So I decided to take up motorcycling for a hobby, just learn to ride a bike for a hobby. That hobby turned into a bit of a passion, and 3 years after learning to ride a motorcycle, I became a national champion at endurance racing. Not just me, but me and my team members. And I continued that up until 2014. I got out of that in 2014, 2015. I needed something to do, so I took up kickboxing. 2 years later, I won a national title at kickboxing for my weight and age group. I would have been about 47 at the time. I got out of kickboxing and then got into boxing. And although there isn't an official semi-professional level, I started off at white collar, got through that, had 4 or 5 white collar fights, won them all, the first 3 in the first round, and I decided I needed a bit more sort of a challenge. So I ended up doing a little bit what we refer to as kind of semi-professional boxing. So I turned semi-pro as a boxer when I was 53 years of age. I'm now 59, yes, I know, 59, and I'm still fighting, still enjoying it. I turned 60 in September, and my aim is to get in the ring at the age of 60. Not necessarily against another 60-year-old, I don't care who it is. Mike Tyson, Jake Paul, you bring them on, I'll take them on. If anybody here fancies a fight, come and see me after. Not today, by the way, we're all in a good place here. And I'm also involved in one other sport, which is my latest love, which is clay pigeon shooting. And I've got the World Championships next month. I'm competing, I think it's July 14th and 15th. And if I get through those qualifying rounds, I'll have the final at the weekend. So my life has been sport. Now you might ask yourself, okay, that's great, but why are you standing here telling us all about that? In fact, why am I here? Well, the reason that I'm here is actually because I know the ingredients and the skills and the skill set that it takes to develop winning teams, individuals, and organisations. And that's why I'm here today. And in fact, myself and a few other people who are in this room today, we developed another winning team, and that is Right Brain International Thinking. And believe you me, that team didn't happen overnight. That took the best part of 2 years to develop. And I want to talk a little bit about what right brain thinking do and what is our thought process and what we're wanting to achieve. Now, one of those ingredients that I talked about that we have in the world of sport is performance. Performance is key. Let me give you a couple of examples. One of the events I competed in athletics was I was a member of the British 4x400 metres relay team. I was an individual 400 metre runner, but very fortunate to be able to compete in the relay as well. Now, the great thing about competing for your country in a team sport is, guess what? They take the best people. So in the relay team, the 4x400 metres relay Olympic team or World Championship team was made up of the 4 fastest guys that could run 400 metres in Great Britain. It's very simple. You are judged on your performance. In 1991, very quickly, I'll tell you this story. It's not part of this, but I'll say it anyway. In 1991, the British relay team went out to the World Championships in Tokyo. We were ranked number 2 in the world. The Americans were number 1. Unbeaten for 57 years, American. They were the Olympic champions, the world champions. They held the world record. Great Britain were the Olympic silver medalists, the world silver medalists, had the 2nd fastest time in history. And we went to those world championships with the dream of becoming world champions. We got through to the final. Our team managers picked our order. I'll go through the names. You might know them. Me on the first leg. Then it was Chris Akabusi. Anyone remember Chris Akabusi? He was due on the 2nd leg. John Regis on the 3rd leg, and then Roger Black on the 4th leg. And it was picked in the usual way. Our industry, there is a way that you pick your relay team. You put your fastest man last, your 2nd fastest man first, and the other 2, you just chuck them in the middle. Technically, that's pretty much how it's done. But we decided that actually the night before the race that we needed to change that order, and we mixed that order up. And the result was Great Britain won the World Championships in the men's 4x400 metres relay for the first time in 57 years. Now, there's a lot to be learnt on that. Number 1, people were judged, the athlete were judged on their performance. And number 2, we were prepared to do something a little different. I want to give you a second example when we talk about performance, which will bring us on to right brain thinking. 2013, Melbourne, and it was the Melbourne F1. There's a team called Ferrari. and they were coming in to have their driver was coming in to have their tyres changed. As he's making his way down the pit lane, there were 24 personnel standing outside the Ferrari garage, all dressed in red. Red outfits, red training shoes, red helmets. The car comes in. Under 3 seconds later, that car was screeching its tyres and back out of the pit lane. 4 tyres had been changed in under 3 seconds. 25 people, including the driver, made that happen. But the bit that was interesting for me wasn't actually what they did, it was who did it. 24 people, all dressed in red, with helmets on, walked outside the garage. The car comes in, 3 seconds later, under 3 seconds later, it's gone. Those 24 people walked in. Now, if you could see that video, and I froze that video as they were walking in, you can't tell how many were male, how many were female, how many were people of colour, how many people, I don't know, were dyslexic or had any kind of disability. You couldn't see that. They take their helmets off, sit back down and watch the rest of the race. Then you can see at least the obvious dynamics of male to female and to different colours of people. In sport, we are judged on our performance. When I crossed over and made that transition from the world of sport to the world of business, that's not what the case is. And unfortunately, it still isn't. What we try to do at Right Brain Thinking is we're all about getting the right people for the right jobs. And that's done in a number of ways. We have a number of bespoke programs that are tailored to organizations where we can help you with your recruitment. We can help with your leadership. We help with your high-performing teams program. We have a DE&I profit driver program. We even delve into the world of AI. I'm not going to talk about that because it's not my expertise. But these are the ingredients that helped me and hundreds of thousands of other sports men and women become successful in what they do. We are now taking those transferable skills from the world of sport and bringing them into the world of business. And that's what it's about. So, Right Brain Thinking International can help you as an individual, as a department, or as an organization achieve whatever it is that you want to achieve through the development of your people. One of the reasons that we're here at this event is we are very interested and very keen on working with companies within the Middle East, because we know you've got your Futures 2030 program that vision that you're working on. And a lot of what you are aligned to is what we're aligned to. And it makes sense for us to work with you to help you become the best organization that you can. And in fact, to give you a competitive edge against your competitors. I'm going to go back to that relay team just for a few seconds. And this is a point in question. That relay team consisted of the 4 guys that I mentioned, myself, Chris, John, and Roger. We were the second fastest team in the world. We didn't change our personnel. We didn't fire a couple of athletes and hire a couple of other athletes. It was just a mindset that we took. And we decided to do something a bit slightly different. And it took us from already being world class, but it took us to being the world's best. That is what we do at Right Brain Thinking. And I could stand here and talk for hours on all the different facets that can help your organization become better than where it is. But unfortunately, I don't particularly have the time. But I am here, we've got some of the team here, we're downstairs at, I think it's stand number 5. Please come and talk to us and have a conversation on how we can help you and your organization perform better. And let's face it, do what everybody wants to do, and that's increase that bottom line. There are reports out there, you don't have to take it from me, I always use one from McKinsey & Co, that talk about organizations that have a much more diverse staff, have diverse staffing and personnel, have a more diverse way of thinking. Actually, their profits can increase by up to 34 or 35%. Our team of deliverers are not just made up of me. We have some, I like to refer to them as world-class deliverers that aren't just talking the talk, they've actually walked the walk. So please come and see us. You can get us on LinkedIn. We've got a website, rightbrainthinkinginternational.com, I think is correct, but come and have a word with us. And I hope that's just given you a little insight to what we're doing and how we can maybe help you become the best version of you and your organisation. Thank you very much.
So we're at the time of this discussion where we're just going to either open up the floor and deal with a couple of other questions. Now, can I see a show of hands? How many employers are in the room today? Okay, and how many educators? Okay, and how many government policy makers or anybody who is influential in that way? Okay, so we've heard from HAIFA that the statistics of women who are going to university in the Middle East has significantly increased. But we're also finding that there is a gap in terms of the opportunities for them. Now, the Middle East has a nationalization program where most employers in these countries are required to employ a specific number of nationals. Now, I think that may well help to bridge that gap. But what else can we be doing to ensure that our, not just females, but I think that, the next, to future-proof the workforce for the next generation, what should we be doing? HAIFA,
Thank you very much.
Thank you.
I would like, to raise another important point for our region, which I mentioned a bit earlier. We have huge youth unemployment. It's not just female unemployment in the region. We have a huge youth unemployment in the region. We have very educated youth, but unfortunately, as we said, there is a mismatch between what the market needs and what the universities have been preparing the students for. So there is a lot of need for partnerships between industry and academia. We need to see more collaboration. We need to see more training programs and apprenticeships introduced for not only even university students, for school students. In the UK, I remember when my son went to boarding school here every summer, he was, from the age of 13, he had to do a summer job and to present a report about it when he went back to school in September. We need this kind of interaction with the private sector, with the business community, so that the students from an early age, female and male students, get exposed and feel confident and be able also to identify their careers through these experiences. So we need to see more members from the private sector sit on the boards of universities. We need to see the private sector arrange training for these students, whether in the summer or other times. We need to see more focus on skills. It is all about skills, skilling, upskilling, reskilling. This is what that the region now calls for. We need the soft skills while we also need the technology. You need both. And importantly, we see also now there is a top-down approach across the region to bring down barriers for women in the region. Women are being encouraged to start their own businesses. Women are being given even the financing in some cases, the facilities, access to finance. So we have a lot of encouragement coming through. Also, when you see the government supporting women's role in the private sector through setting up small and medium-sized businesses, this is changing perceptions also about the role of women, so that women can be the homemakers, but they can also succeed in business, can succeed in whatever profession they want to succeed in. So I think what is happening is positive. We need to work harder to make the figures better, But the journey continues, and we have very good, I always like to focus on the positive. There are many positive stories emanating from the region of women excelling in so many sectors. And I've given you the figures about women excelling in the STEM subjects and in STEM sectors. But we need to see greater figures for both men and women to enter the private sector. Many want to work in government and the public sector, but at the end of the day, we all know that the private sector is the engine of growth.
Thank you. Now, the perspective of KOSAR, who unfortunately wasn't able to join us today, was that entrepreneurism is intrinsic. It's not something you can learn. You either have it or you don't. His view was that perhaps you have been influenced by a situation, a family business, or some other experience that drives you to have that entrepreneurial mindset. Now, Derek, if I may, our clock is ticking down. Could I ask perhaps a couple of minutes on your perspective of how your lessons from elite sport, such as resilience and adaptability, do you think that they can create an entrepreneur?
Can they create an entrepreneur? I would say no. Can they help develop entrepreneurs? Then I would say yes. For me, somebody's behaviours is what will show their entrepreneurship. I do a lot using psychometric assessments, and we do at Right Brain Thinking International. We use quite a lot of, if we need to, psychometric assessments. And by taking one of those, we are able to sort of pinpoint and look at people's behaviours and look actually again at where their strengths and limitations are. Some people call them strengths and weaknesses. We refer to them as strengths and limitations. So when it comes to entrepreneurs, yes, there are traits that people will show, and we can see that in their behaviours, and that they show that they are very entrepreneurial. And what we will try and do is focus on those traits and work on them so that they get the opportunity to become more entrepreneurial. If I dare be as brave to say is, I've done some work in secondary schools, and because of the way that the school's curriculum tends to be, it tends to quash entrepreneurial behaviours in students, and it's those that seem to rebel against the system that end up becoming the entrepreneurs. And if you look at some of the great businessmen and women just in this country alone, you'll find that a lot of them possibly dropped out of school. Sir Alan Sugar comes to mind, dropped out of school because the school didn't really help them develop in the way that they wanted. So yes, I think it can help those skills. It can't make you an entrepreneur, but it can certainly help develop those skills and behaviours.
Thank you. I mean, academia isn't for everyone, and I think a lot of the education, a lot of schools are now introducing more vocational courses, and we're going back to sort of BTEC, and in my day it was called the YTS scheme. I don't know if there's anyone that remembers that, but so it's great so Dr. Thomas, it's great to hear that Moorfields are doing an awful lot in terms of training and academies to promote entrepreneurs, to help them with technological startups, and that's fantastic, because obviously there's a lot of change in the way that the current generation, I think, what they want from their work and what they're prepared to give to it. But are you seeing, I mean, what would you say the main challenges that entrepreneurs in the healthcare sector face?
Yeah, I mean, I think we've had what we sort of describe as an implementation gap that's existed for quite a long time. So the UK generates vast quantities of research, and my own organisation publishes more papers in Eyes and Vision than any other organisation in the world. But what we've seen that seems to be a bit peculiar about the UK historically is that massive body of academic research didn't necessarily translate through to inventions and products in the same way that you might find in an ecosystem like around Stanford in the States, for example. I think we're gradually chipping away at that. So in the current generation I see as doctors, in my younger colleagues, they are far more interested in entrepreneurial careers, in portfolio careers, where they spend some of their time in clinical practice. But I've got colleagues who are chief medical officers of their own startups, 3 years after medical school, and who are focusing their academic and research interest no longer in sort of abstract research topics, but research topics that lead directly through to implementation. So that's why we've had this explosion of startups in health tech in the UK. And I think the next phase is making the health service here a bit more like health services abroad, so it's a bit easier to sell into it. Because what you do find is quite a lot of these successful UK-based health tech startups, after a while say, well, actually, we're going to focus on the States, because in the US is where we can sell our technology and implement it. So there's quite a lot of work going on at the moment. I think we've got a fundamental question that's being asked now, which is, do we rely on traditional hospitals to drive the next generation of digital transformation? Or do we look for new models where we have a hospital that is purely based around digital and virtual care? Or like at Moorfields, where we've set up a digital hospital unit to specialize in that. Now, I think that's the final bit of the puzzle, where we create a health service that can take the products we develop easier. But yeah, I think we're getting there.
Excellent. I'd like to thank all of my speakers. The world is changing. Clearly, our educators, our governments are all responsible and should join forces to ensure that we engage the next generation of the workforce, because what they need and what we need is ever changing. And I think that there are some really exciting things that can be done we don't want to lose that talent to other countries. We've got many very talented females in the Middle East that are looking for opportunities. So, we need to work together as a team. But please let's keep this conversation going, because it's not just in rooms like these, but we need to be able to shape the policy and lead organisations and mentor those that are coming after us. So thank you all for being here. I'd like to thank Derek Redmond, Dr. Peter Thomas, HAIFA ALKAYLANI, and thank you and enjoy the rest of the summit.